This is Dr. Deepa, Department of General Pathology, SRM Dental College, Ramapuram. Today, the topic of discussion is necrosis. Necrosis can be defined as a localized area of death and degradation of tissue by hydrolytic enzyme liberated from dead cells, which means once the cell is dead, it gets degraded by hydrolytic enzymes, which are liberated from the dead cells. There are 5 various types of necrosis: coagulative, liquefaction necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. Let us have a brief discussion on each of them. The first type of necrosis is coagulative necrosis. Coagulative necrosis is a type of cell death. This type of cell death usually occurs when there is cessation of blood flow, that is otherwise called as ischemia. So here what happens is there will be complete blockage of blood, which in turn will lead to death of the cell. This type of necrosis can happen anywhere in the body except for the brain. Macroscopically, or a gross appearance of coagulative necrosis is that it has a pale segment of tissue. As you can see in the picture, there is a localized area of pale segment of tissue, which is the necrosed area. This is surrounded by vascularized tissue. Second type of necrosis is liquefactive or colliquative necrosis. This type of necrosis takes place when there is excessive loss of tissue replaced by collection of liquid. This is most commonly seen in brain and other areas such as in abscess where there is lot of acute inflammatory cells. Because of release of proteolytic enzymes, they destroy the surrounding tissue and there will be excess collection of liquid or pus. Grossly, as you can see, there is a localized area of cell death with collection of pus. Caseous necrosis is the third type of necrosis. Then in this type of necrosis, there is cell death that causes tissue to become cheese-like. Hence it is called as caseous, which means cheese-like. Histologically, there is necrosis wherein there is eosinophilic, granular and acellular material which is characterized by complete loss of tissue structure. In contrast to this, coagulative necrosis preserves some tissue outline, whereas in caseous necrosis, there is complete loss of tissue structure and there is replacement of this with cheesy appearance. Fat necrosis is a form of necrosis that is caused by action of lipases on adipocytes, which is fat cells. In fat necrosis, the enzyme lipase will release some fatty acids from triglycerides, and these fatty acids will form complex with calcium to form soaps, and these 4 soaps are the ones that appear or that gives a white chalky deposits which are seen in this picture. Fibrinoid necrosis is characterized by deposition of fibrin-like material which has the staining properties of fibrin. This is usually seen in tissue injuries, peptic ulcer, and also in arterioles and hypertension. Microscopically, it is bright eosinophilic, as you can see in picture. It is eosinophilic and it has a hyaline-like deposition, generally seen in the blood vessel walls. So the necrotic focus there you see which is surrounded by nuclear debris of neutrophils. Also you can see in the picture there is local hemorrhage which appears more eosinophilic. This is usually because of rupture of blood vessels. This was a very brief note on the different types of necrosis. I am Dr. Deepa from SRM Dental College. Thank you.